First of all, yeah, I think it's encouraging that the mortality rates and the incidence of cancer, generally speaking, is trending in the right direction. I think that's a reflection of a number of things. One is detection, two is screening programs, and three, essentially treatment options have become a lot more advanced over the last 10, 20, 30 years. And so I think put all that together, you kind of see kind of a global trend towards improvement in cancer outcomes. Early detection, if we can find a way to detect cancers early, for the most part, cancers caught early have more favorable outcomes, both in terms of survival and in terms of long-term side effects that patients have. Typically, earlier stage cancers demand far less aggressive treatment, and so if we can avoid more aggressive treatments for earlier stage cancers, then we've done people a favor. So not just from a survival benefit perspective, but also from a toxicity standpoint. Breast cancer, mammograms definitely have improved outcomes for women. Prostate cancer, actually the data are a little bit controversial about whether early detection actually saves lives. Mm-hmm. What's true about early detection for prostate cancer is that we catch a lot more of those. And when PSA testing and screening was first introduced in the late 80s, early 90s, you saw a spike in the incidence or the number of cases that were reported of prostate cancer. But it was less clear whether or not we were saving a lot of men's lives as a result of that early detection. The ideal screening program would be one where early detection would lead to a potential life-saving treatment. There's no point in detecting a cancer early if the treatment options that we offer aren't going to make a difference in mortality. The issue with prostate cancer screening is that the ability to detect a prostate cancer is so good that we're catching things that are potentially not life-threatening. Mm-hmm. So it's a debate whether or not catching those really early really do benefit the patient in the long run, because the other danger of screening patients with really, really early stage cancers is that you overtreat them. Mm-hmm. And you put them through unnecessary tests that themselves have some small risk. There are the other screening tests that we do for cancers, colon cancer. So the recommendation is to start for the general population, colonoscopies at age 50. That has been demonstrated to lead to good cancer outcomes. So more patients survive as a result of that screening program. And so that's a very easy thing to recommend, because you can actually do something about it. With colon cancers, typically, if you see something that's precancerous, you can take it out and prevent that from becoming cancerous. Mm-hmm. I would say the one cancer that's common that we're having trouble with still is lung cancer. Mm-hmm. On the plus side, with the Surgeon General having first published the ill effects of smoking, mm-hmm. We've seen a downward trend in the right direction of people not smoking as frequently, and that echoes a drop in the rates at which people are being diagnosed with lung cancer. So, but the actual treatment for lung cancer is still very tough. Okay. It's not come as far along as I would say things like breast cancer or prostate cancer, but for lung cancer in particular, if we can catch those earlier, patients do a lot better. A few years ago, there was a study that came out for lung cancer screening using CT scans to detect lung cancers for patients who are some risk of developing a lung cancer, particularly those with a modest smoking history. And that showed that there was a benefit doing the screening for those patients. And time will tell, but if there's a bigger uptake of that screening program, I think we could potentially make some difference in terms of lung cancer mortality.